Dr. Sonny Ukachakwu, Medical Director, Primus International Specialty Hospital, says medical tourism can only be discouraged if government curbs corruption and strengthens institutions in the health sector. Ukachakwu gave the advice at the News Agency of Nigeria Forum in Abuja.
You cannot step into any state of this country and see a proper diagnosis center. So where do you start? You see, when you diagnose properly, that is when you get the doctor will know the way to follow. So, and I believe that governments have this money and they have been pushing this money into health, and we're expecting that you see same every other place, but you see nothing. So to me, the money has been going out for it, but you don't see it there. So the question becomes, where is the money? Corruption. Best doctors go out there. You run into some of these bigger facilities. You see Nigerians there. If you have these equipments here, of course, they will be encouraged to come home and give the services to his people. But they cannot. Primus International Specialty Hospital came into being actually from 2010, but started its services from April 11th, 2011. You know, looking at the backwardness of medical industry in this country, in conjunction with MFCT, so the development came that some foreign partners want to invest on medical care industry. We graciously we leased a space from them, and the services to be expected is on secondary and tertiary. And since that 2011, Primus International Specialty Hospital has been on its feet towards service delivery. From that time till now, we can number so many spine surgery has been done by the hospital. Brain surgery, we call neuro, knee replacement, hip replacement, cochlear implant has been done as well. So many cases that most of Nigerians travel abroad to go and have. And even up to date, the Primus Hospital is still at the peak point, delivering those services. Like we have one of the best neurospine surgeon with 25 years experience. We have one of the best ortho with 30 years experience. They're all Indians. We have one of the best ENT doctors that does cochlear implant. He's from Korea. Remains most of the patients that goes outside this country for medical tourism are being referred by same Nigerian doctors. Most. I can tell you about 80 or 90% of them. So what does that mean? That means that those doctors that are referring those patients don't believe in Nigeria. Our neurospine and some other consultants as well have revisits or reduced some surgeries being done in India. So what does that tell? That tells that we're still better than them. So what I'm trying to say in essence is that until we start to believe on us, if we believe on us, believe you me, there are some good places you can go in this country and get a very first-class medical attention.
Speaking, Dr. Tony Momo, Medical Superintendent of the hospital, advised government to carry out proper assessment of patients before granting them approval to travel for medical care.
Most of the people who go outside the country to seek medical treatment have no business going there in the first place. Because out of greed and insincerity of medical practitioners, even those things that could be done here are being referred outside. And until government clamps down on proper assessment of all patients before visas are given out to go outside, our hard-earned resources, our hard-earned scared forex will continue to be spent unnecessarily. People who go outside are not going, most of them will go for medical treatment. They go for tourism. to go and buy gold, to go and buy all these things. And they come back, some of them go to go and do other vices outside the country, and our prices are not comparable to any center that render the same services in Abuja here. And we have on-time delivery of services, and we visit our patient on phone calls and email to find out how they are doing and all that. And we have spread our tentacles to all the states of Nigeria.